Hi, Dr. Dan here again. Today I'd like to talk about the most common female pelvic cancer, and that's endometrial or uterine cancer. The diagnosis of uterine cancer for most patients is one of the best diagnoses you can have. Most people will be cured of this cancer by just a simple removal of the uterus, and we'll talk a little bit more about that in a couple of minutes. So everybody typically asks us what causes uterine cancer, and what we find is for the majority of people, it's due to excess hormones that your body produces. Fatty tissue is very, very good at making estrogen-like molecules, and those estrogen molecules tend to stimulate the uterus to get more proliferating, and those proliferating cells become more atypical and eventually turn into a uterine cancer. Most people present with uterine cancer complaining of some postmenopausal bleeding. And we commonly see people that have been told, oh, don't worry about postmenopausal bleeding, it just means you're still going through menopause. The most important thing I'd like to get across to everybody today is if you are postmenopausal, have stopped having your periods, and then start bleeding again, that is abnormal, and you need to see somebody and get it checked out. So how do we check it out? The most common thing we do is what we call an endometrial biopsy. These biopsies can be safely done in the office. I have my little biopsy instrument here. This is called a pipelle. And basically we insert this into the uterus and just scrape the inside of the cavity to get some cells. We send those cells off for the pathologist to look at to see what's going on. With this biopsy instrument, we're able to tell you whether you have a precancer of the uterus or an actual uterine cancer. Once we make the diagnosis of a uterine cancer, our typical surgery involves robotic hysterectomy. We're using the robot now for most patients with uterine cancer because their recovery is so quick and it's outpatient surgery. The amount of bleeding we have at the time of surgery is minimal, and our patients recover so quickly from this type of surgery. The surgery itself takes about an hour to an hour and a half to do. We typically remove the uterus and cervix, both tubes and ovaries, and we sample the lymph nodes at the same time. There are certain individual cases where we will save an ovary or we don't have to do the lymph nodes. It really just depends on the pathology that we're dealing with. Again, for most patients after surgery, when they come back to the office, the good news is you're cured, you don't need any further treatment. Some people, however, will need some radiation and/or chemotherapy afterwards, and that becomes an individual basis, and we talk about that at the time of your post-operative visit. So again, if you or anybody you know has a diagnosis of uterine cancer and you need to see somebody or a second opinion about the correct procedure for them, please let us know. We'll be more than happy to help you. I would encourage anybody who has a diagnosis of uterine cancer to be seen and treated by a gynecologic oncologist. We spend our entire lives dealing with these type of cancers, knowing the ins and outs, and we want to try and do the best procedure for you so that you have the best chance of an excellent outcome. Thanks again for tuning in. Hope to hear from you soon.